All right, we are live. There we go. All right, so hello again, everybody. My name is Dustin Honig, and I'm a registered dietitian intern, giving you part 2 of the 3-part chronic kidney disease educational series. And the topic for part 2 is going to be on nutrient needs while on hemodialysis. All right, so to jump into it, we're going to start with how being on dialysis can affect your nutritional needs. This is for a few reasons. So essentially, whenever your body is being filtered through hemodialysis, it's going to be filtering out waste products. But unfortunately, hemodialysis is not as specific in filtration as your kidneys. So whenever you're going through these treatments, it can cause the body to lose a few different nutrients. And the main nutrients it causes your body to lose are protein, fluids and water, B vitamins and vitamin C, and your minerals and electrolytes all are going to be lost to some extent during your hemodialysis treatments. And this is this can be actually beneficial, well, with the exception of certain nutrient loss. It's beneficial for the electrolytes to be controlled through hemodialysis because the kidneys are less able to do so, and the kidneys are less able to control fluid balance. So between hemodialysis treatments, generally, most patients will see some degree of fluid buildup or edema. And this is because, as we know, the kidneys are less able to filter the blood and filter out excess fluids, so it causes a buildup, and can be removed during hemodialysis. So this is also an important reason why monitoring electrolyte intake is important to reduce edema between treatments. And I'm talking about primarily sodium and potassium. It can also help to control blood pressure. And when you're helping to keep your blood pressure in more normal ranges, it helps to improve your kidneys' health and decreases the stress on the kidneys. Additionally, the fluid intake is something that should be monitored and controlled to help prevent excess weight gain in between dialysis sessions, and that's in the form of water weight gain. All right, so from now, we're going to jump into certain nutritional recommendations when you're on hemodialysis. So when you're on hemodialysis treatments, you actually have a new set of guidelines that I'm going to go over most of within this PowerPoint presentation, starting with calories and protein. So as you know, calorie requirements in general can be quite different based on people's age, weight, nutritional status, and the cause of the chronic kidney disease. So, for example, someone who's 5'0", weighs 110 pounds is going to have a different calorie and protein need than someone who's 6'2" and 220 pounds. So, in general, 25 to 35 calories per kilogram of ideal body weight is sufficient to provide adequate calories and protein on a daily basis. And depending on where you fall in that range, or depending on your metabolic activity, your metabolic rate, that in addition to exercise and certain other factors can determine where you fall in that range of 25 to 35 calories. So it's very individualized. There's no one size fits all, but generally most people will fall within that range. So overweight and obese chronic kidney disease patients, they have a different guideline that they might benefit from modest weight loss. And that means improvement in certain symptoms, decreased stress on the kidneys. And this could be achieved through weight loss as small as 10% of your total body weight. And most people think you need to drop 150, 100, 150 pounds, depending on where you may fall. 10% of your body weight can be sufficient to see significant improvements in many chronic diseases, including chronic kidney disease. So, while most individuals with CKD should eat a moderate amount of protein to prevent extra stress on the kidneys, and that stage is usually 1 through 4, hemodialysis patients have a much higher protein need at 1.2 grams per kilogram of body weight. So that's almost 1.5 times the normal recommendation. For most chronic kidney disease patients, stage 1 through 4, 0.8 grams per kilogram is the recommendation. So this is significantly higher. So for carbohydrates and blood sugar, this slide is going to be especially important if you're a diabetic with chronic kidney disease. So it's important that diabetic chronic kidney disease and hemodialysis patients monitor their blood glucose and moderate their carbohydrate intake. And this is important to help keep your blood glucose in normal ranges so that, as we mentioned in the first part of this educational series, your body does not have that excess inflammation caused by chronic high blood sugar or hyperglycemia. So when you help keep your blood sugar at normal levels, you're helping to improve your kidneys' health and decrease stress on the kidneys. So aside from all the sugars and other carbohydrates, fiber is an exception. And this is because it has many health benefits to many individuals with chronic kidney disease and diabetes. And this can include promoting regularity, can help to control your blood lipids like your triglycerides and your LDL, HDL, things like that, and it has an impact on those. And it also doesn't cause that same spike in blood sugar as other carbohydrates might. Fiber has a lower calorie count per gram, it's much lower. And whenever you consume fiber, it helps to control the rate of digestion. And even if you take it with other carbohydrates, it can kind of help keep your blood sugar from spiking higher than it would if you just ate those other types of carbohydrates alone. So fiber is absolutely an exception. I think it should absolutely be included on a regular basis in sufficient amounts. And for most people, that's about 20 to 40 grams of fiber per day, depending on if you're a male or female, body frame size, things like that. So for controlling blood sugar, one of the most effective methods is to spread carbohydrates out throughout the day. So basically there's a diet, for example, called the controlled carbohydrate diet. And that's essentially having small to moderate portions of carbohydrates throughout more small meals throughout the day. So instead of 3 big sittings of whatever amount of carbohydrates, maybe have 5 to 6, each with a small amount of carbohydrates. And this helps to keep your blood sugar normalized versus going into highs and lows after and in between meals. So it helps keep your glucose more regular. And as we know, preventing high blood sugar episodes can slow the progression of CKD by not having that excess stress and inflammation on the kidneys. All right, so water-soluble vitamins, we're going to go into those. So we have a nice little fancy chart on the bottom right to kind of break down your different water-soluble vitamins versus your fat-soluble vitamins, which will be the next slide. So there's a slide for these because these vitamins are at risk for deficiency if you're on hemodialysis. And this is because of losses during dialysis treatments and dietary restrictions. So for example, for dietary restrictions, most people on dialysis want to avoid too much potassium. And many foods that are good sources of potassium also have high amounts of vitamin C and all of your B vitamins. So when you reduce your intake of these foods because of chronic kidney disease, it causes you to miss out on potential nutrition that you would get from your B vitamins and C vitamins. So those between the dietary restrictions and dialysis, it makes it difficult to get enough of these too. So there's a lot of B vitamins. The main ones we're going to focus here on B12 and folate. And these two are specific to causing anemia, among other things, like neurological disorders and nerve damage. So most of your B vitamins are essential for doing things with your metabolism, for building up, breaking down tissues. They act as, what's the word I'm looking for? Coenzymes, cofactors, things like that. So they have a ton of roles in the body. Your B12 and folate are very important to your nervous system. And they're also important to the production of red blood cells. So when you have deficiencies in these two, it can cause nerve damage and also can cause anemia. So vitamin C, and this one's another one that can contribute to the same problems. This is why anemia is so common amongst chronic kidney disease patients on hemodialysis, because when there's not enough vitamin C, it interferes with the ability to metabolize iron. And when you're not getting enough iron because it's unable to be metabolized properly, it can contribute to anemia. So between B12, folate, and vitamin C, all these specifically can contribute directly to having anemia secondary to chronic kidney disease. So it may be beneficial to supplement these vitamins under medical supervision from your physician or dietitian. Fat-soluble vitamins, this is next. So these are going to be your vitamins A, D, E, and K. So deficiency in these vitamins is generally less of a concern than water-soluble vitamins because the body is better able to store these vitamins. So these vitamins are stored in your fat cells all across the body, no matter where they may be. So they're able to be stored for a much longer term, and your body can retain certain levels of these nutrients even well after all of your water-soluble nutrients have run out, like your vitamin C and your B vitamins. So these vitamins are typically not too much of a concern for deficiency, with the exception of vitamin D. That's because whenever your kidneys are having issues or have chronic kidney disease, your body is less able to activate that vitamin D. Kidneys are less able to activate it. So therefore, when you have chronic kidney disease, there's less activated vitamin D around in your body to do its job, which can cause the same symptoms and issues as a vitamin D deficiency. So vitamin D is an exception here. Sodium, potassium, and phosphate. So these are going to be some of your main electrolytes that you're going to have to take a look at and try to consume on a moderate or restricted basis. And it's important to it's important to limit these three if you have chronic kidney disease because you have the reduced ability to excrete these nutrients. So whenever you have high levels of sodium potassium buildup, that can increase the strain on the heart and the kidneys and can adversely affect blood pressure, can generally lead to hypertension. In addition, high levels of phosphate can cause the body to pull calcium from the bones and to calcify blood vessels. So your body makes a few important hormones to regulate the amount of calcium that stays in your bloodstream and how much stays in the blood. How much stays in the bones versus the bloodstream. So when you have too much phosphate that builds up in your bloodstream, it can affect basically how these hormones do their job, which can essentially cause the blood to have too much calcium, but it's tricked into thinking there's not enough, and it continues to pull from the bones, causing bone frailty. You can cause decalcification of bones, and it can cause calcification of blood vessels, which can cause additional problems for strain on your heart, strain on your kidneys, and it, of course, affects your circulatory system. So these are all important nutrients to keep in check, to keep your heart safe, to keep your bones safe, and to protect your kidneys. All right, so fluids and edema when you're on hemodialysis. So as well as the decreased ability to eliminate electrolytes, you also have the decreased ability to excrete water, like to go along with the sodium electrolytes like sodium and potassium. So it's helpful to restrict fluid intake to prevent edema in between hemodialysis sessions. For those who may not know, edema is swelling that is caused by excess fluids that are trapped in the body's tissues. And for chronic kidney disease patients, usually this will be found around the eyes and in the legs, the lower extremities. And it is common to experience weight fluctuations during hemodialysis due to excess fluids building up and being removed before and after sessions. So fluids are something that need to be regulated daily. You don't want to overconsume fluids and then gain an excessive amount of water weight in between sessions because it can impact the effectiveness of your hemodialysis. So this is something you want to regulate. All right, so some tips to help meet some of these nutrition goals and needs. So we went over a lot. So just some good general ideas to help are for your protein, always try to consume high quality protein sources such as meat, fish, poultry, and eggs. And this is because these high quality protein sources basically have all of the amino acids that your body needs to do its job, function and do its job properly. And these are the amino acids that it cannot make by itself. So these are complete protein sources. So these are something you want to get more of, because when you have incomplete protein sources, your body will be able to do most of these functions, but if you're missing out on certain amino acids, which are the building blocks of proteins, it may be unable to do other functions. So always try to get balanced amino acid sources, which are complete proteins, such as meat, fish, poultry, or eggs. Additionally, you want to avoid foods and beverages that are high in simple and added sugars, and look for those that are good sources of fiber. This is for blood sugar control, mostly, to prevent hyperglycemia and to thus prevent extra damage to the kidneys. You want to limit dairy products, especially because they are high in phosphorus. And that goes for almost all dairy, high-fat dairy, low-fat dairy. That content doesn't matter. Almost all dairy has a high phosphorus content. And if you consume too much dairy, it can cause issues with bone health and calcification of your circulatory system, your veins and arteries. So also you want to try to eliminate the intake of fluids aside from water and coffee in moderation. Use very restricted fluid requirements for a day, so you want to make sure you're trying to get that from actual water, from other sources like soda, other less healthful beverages. Coffee in moderation has been shown to have some benefit for people with CKD. So that is going to be a beverage in addition to water that can be accepted in moderation. And when you're calculating your fluid intake for the day, you need to take into consideration that liquid consistency foods should count towards your fluid intake for the day. And that's things like soups, stews, things that have a high water content. So, and if you have, met your fluid goals for the day and you still find that maybe your mouth is dry, maybe you're a little thirsty, it's always good to have gum or mints to kind of control the dry mouth, or you can chew on ice chips, things like that, to kind of help control the thirst. All right, and I got a little handout for you here. So basically, this is like a cheat sheet for foods to avoid for CKD and hemodialysis, along with some of the guidelines that we went over today. So this basically kind of goes over specific foods that you may want to avoid when you're on hemodialysis. I feel like I've seen a lot of handouts that include foods that are good to consume, but I find that there are many more foods that are acceptable than those that are not. So I feel like if you avoid most of these foods or limit most of these foods that are on this list, then you can avoid some of the problems with high potassium, high phosphorus, high sodium, some of the other issues that go with that. And avoiding these foods helps to meet the guidelines that are listed across the top, which are the 2 grams of sodium, around 2 grams of potassium, and 1 gram of phosphorus. So this is just a kind of little cheat sheet to kind of help you stay on track. And if you ever don't know what foods may or may not be a good idea, you can reference this. And also it goes over general recommendations of how much you should try to consume from each food group in a day. And this is based off of the MyPlate guidelines for chronic kidney disease patients. All right, and this is just the summary of recommendations for when you're on hemodialysis. So as I mentioned, calories, you're going to want 25 to 35 calories per kilogram of ideal body weight per day based on activity level, metabolism, things like that. It's good to check with your dietitian to determine a more accurate, specific number than the range. But for protein, the 1.2 grams per kilogram of body weight per day, and this is higher because you have losses during hemodialysis and dietary, certain dietary restrictions, but mostly because of the losses during the hemodialysis sessions. So carbohydrates and fats, it's always good to moderate the amounts of both of these and try to spread them out throughout the day and not binge on them in specific meals. Sodium, around 2 grams per day. Potassium is the same as sodium. You want around 2 grams per day. And you want to try to limit phosphorus to 1 gram per day. For fluid intake, there's about 100 million different recommendations that you can find on the internet of how much to drink. What I find to be most accurate is to limit the intake to around 1 liter per day, and you want to add the volume equal to the amount that you urinate in 24 hours. So if you're going to the restroom and you find that there's maybe like 1/5 of a liter of urine in a day, that means you want 1.2 liters of fluid per day. So that's a good general recommendation guideline for that as well. All right, and da-ba-da-da, part 2 is complete. We made it. Thank you guys for listening, and I'll see you soon for part 3.